Hi, Fred Page. I'm beginning my head and toe assessment, and I'm going to start by introducing myself to the patient. Hi, my name is Fred Page. I'm one of the nurse practitioners. I am going to do an examination of your head to toe. Is there anything you'd like for me to know before we get started?
No.
Okay, all right, good deal. I'm going to start by inspecting the chest. I'm going to inspect the chest from the front, the interior, as well as I'm going to do, put your hands inside for me. I'm going to inspect it from the side. Um, uh, as well as I'm going to do the back as well. I'm going to do an inspection of the back, and I'm going to pay closer attention to the chest wall. I'm inspecting it as well. Everything is, nothing shows out, no deviations or any abnormalities. Next, I'm going to observe the respiratory rate, the respiratory section, the respiratory rate, and the rhythm, and as well as the rise and fall of the chest. There's no retractions. There's no use of accessory muscles, and his effort is not labored. Also, too, I am going to proceed with doing the palpating of the chest wall. I'm going to do that front and back. I'm going to use the palm of my hand, and I'm going to feel across the chest. And I'm going to have the patient have him say 99.
99.
Say it again when I'm touching your chest.
99.
Keep one more time.
99.
Okay, all right. And now I'm going to proceed with doing the back. So will you do me a favor? Will you sit here to the side of the bed, facing that way for me? And I have you do the same thing. I'm going to have you say 99 as well.
99.
Every time I touch you, say 99 for me.
99. 99. 99.
Okay, alrighty. There's no evidence of any presence of any error or anything like that when he said 99. So therefore, I'm going to proceed with the next section. I'm going to position myself behind him. And this is basically going to do the thoracic expansion. And so therefore, I'm going to have you do me a favor. Will you actually point it that way, diagonal? Yep. And what I'm going to do is, basically, I'm going to get behind him, and I'm going to place my hands here, and then I'm going to have you take a deep breath for me. One more time. And that was equal as he took a deep breath, hands separated. Next, I'm going to do my percussion. And what I'm having you do is I'm going to have you sit back for me. So you can lay back on the pillow.
Sit back like that.
Yeah, so you can lay back on the pillow. Okay. And next, what I'm going to do, I'm going to do percussion. And with this, the percussion, I'm going to make sure you see it. I'm going to take my hand, and I'm going to okay. And just the front side, I'm gonna go all the way down. And also too, I'm going to do percussion on the side as well. Can you take your arm and do that for me? And what I'm gonna do is I'm gonna have you do the opposite side so I can actually reach that side. So I'm gonna take the pillow and put it right here so I can actually percuss this side as well. Arm up. Okay. And then also too, I'm gonna have you sit on the side. And so therefore I actually can the posterior side, I'm gonna actually have you the back. I'm gonna have you and have you angle that way for me a little bit. And I'm going to, when I tap, when I say, you take a deep breath for me. One more. One more. And one more. Okay. Alrighty. So then I'm going to proceed. Um, Could I have you lay back up here for me on the pillow? I'm going to now I'm going to listen to breath sounds. I'm going to proceed with my auscultation. Got the diaphragm. I'm going to start. All right, and when I touch you, will you take a deep breath for me, please? Take a deep breath. Okay. And also too, what I'm gonna have you do is I'm going to listen to your back. So what I'm have you do is the same thing, where you sit on the edge of the bed for me and be facing that way towards the window. And now I'm gonna listen to the back. And when I touch you with stethoscope, take a deep breath for me, please. Okay. And then I'm going to have you listen. I gotta listen to your side. I'm going to lift you the left side down so I can listen to your right side. So I'm gonna have you with your feet pointing that way so I can hear that. So just lay on your yeah, you can lay right here because I'm gonna have you do is I'm gonna have you lay on your left side, and so therefore I can listen to your right side. And now I'm going to listen to the right lung. It's the medial lobe. Here, raise your arm for me. And when I touch your stethoscope, take a deep breath for me. Okay. And I listen to the right middle lobe. Okay. All right. And then next, I'm going to. All right. I'm gonna have you sit up for me, and I'm going to have you remove your shirt for me, please. Okay. And I'm going to listen to the 6 areas. I'm going to start with the aortic. Just breathe normal for me. Go over to the pulmonic. And down to Erb's point. And tricuspid. And mitral. And down to epigastric. Okay. All right. I listened to all the 6 areas. And then next I'm going to palpate the pericardium. And basically, I'm checking for any presence of any heaves, thrills, or PMIs. So I'm going to place both of my hands on the chest wall. and I'm looking for any sensations or any vibrations. Okay, and now I'm going to move to listen to the heart. I am going to listen to the, well, start back. I already auscultated the heart, so therefore I'm going to perform an inspection. Um, so that's what I would done before I actually listened to my all the 6 areas which I already have. So I've done it in the supine position. Now I'm going to do it in the sitting position. No, I'm sorry, I've done it in the sitting position. Now I'm going to listen to them in the supine position. So I'm going to have you will lay on your back for me. And I'm going to listen to the 6 areas again while he's in the supine position. Start with the aortic and move on to the pulmonic and Erb's point and tricuspid, and go to the mitral and to the epigastric. And now I'm gonna have you do the same thing. I'm going to have you your lay on your left side, and I listen to them that way. So what I'm gonna have you do is, so we can turn it towards here, I'm gonna have you face as your right side. Your left side, you lay on your left side that way. Yes. Left side down. And now I'm going to listen to those 6 areas again while you're on your left side. Hey, rest that arm down for me. Okay. Start with the aortic. Go over to the pulmonic. And go down to the Erb's point. And to the mitral. I'm sorry, tricuspid. And then mitral. And then epigastric. Okay. Alrighty. Now that I listen to all those areas, I'm going to move over to, you can lay flat, and then I'm going to inspect the neck area for the carotids. I'm expecting the neck area, and there's I don't see as far as any abnormalities or any deviations or anything like that. So what I'm gonna have you do is I'm gonna have you lay that way for me, please. Here, you can take the pillow. And what I'm going to do is I'm going to palpate the carotids. I feel the pulse. And so what I'm gonna have you do is, when I actually place this part of the stethoscope on your neck, when I touch your neck with this, I want you to hold your breath just for a couple seconds, okay? When I say hold, will you hold your breath for me, please? Okay. All right. Hold. Okay. All righty. And what I'm gonna have you do is I'm going to have you go back this way so I can actually do the same thing to your left side. I'm doing the inspecting like I did the other side, the left side. I mean the right side. Now I'm going to inspect the left side. There's no abnormalities, no deviations or anything like that present. Now I'm going to do the same thing. I want to palpate the carotids, gently feeling the pulse. And then I'm gonna ask you to do the same thing when I actually touch you with the stethoscope. I just want you to hold your breath for a couple seconds while I listen, okay? Okay. Hold. Okay. All right. Good deal. Okay. And now I'm going to do the last thing to wrap up with this section. I'm going to locate the pulses. I am going to start by locating the radial pulse. It's right here. And then I move up to the brachial pulse. Okay, alrighty. And then I'm going to have you sit up, straight up for me, please. And then I'm going to locate the pulses in the lower extremities. Can you put one of your pants leg up for me, please? The popliteal pulse is back here in the back of the knee. And then, it's okay, I'm gonna take your sock off. The dorsalis pedis is gonna right here in the top of the foot. And then back here is gonna be the posterior tibia. And that's back here by the ankle. All right, thank you. That concludes my thoracic section.